Welcome to another episode of Health Matters with PA Lynn Szabo. I am Heather Poland, and what are we going to talk about today, Lynn?
We're going to talk about feet. And I have to say this comes from, I don't know, some people might know that I had pretty extensive surgery on my right foot and ankle during the summer, and I was non-weight bearing for about 10 or 11 weeks. And I was miserable because I couldn't drive because it was my right foot. And I really, in all the time in bed looking at my swollen foot, I started pondering about the medicine of feet. So here we go.
The medicine of feet.
Feet,
huh?
yeah.
Okay.
They are often neglected.
Well, of course, they're feet. They're yucky.
Right.
Nobody likes
Yeah,
feet.
nobody likes feet. But they're super important to keeping a person active and healthy. They're super important to gait stability. They're super important to mobility. They're super important to exercise. They're super important, like for diabetics especially, who can easily have a 9 times increase in the average of amputations if they don't take care of their feet.
Oh, wow.
So
That's a lot.
Yeah, they deserve your frequent attention. So I thought I'd take a little bit of time to say how we can keep our feet doing the best for us. So what they do, they bear weight in a foundational way. And this is what kind of blew my mind. This was part of my journey. When my foot and my ankle gave out, then the next thing up the line was my knee and then the hip on the other side, because I was kind of walking with a tilt to my pelvis, and then my lower back started hurting. So
just kind of progressed from there?
Yeah, it kind of progressed. As long as I ignored it, it gave me something else to pay attention to.
What exactly was wrong with your foot that you had to have surgery on?
I had a rupture of my posterior tibial tendon because I was born with flat feet, and the tibial tendon is is the one that goes by the inside bone of your ankle.
Okay.
And so it's the tendon that you use when you go up on tippy toes.
Okay.
So my tendon was ruptured on the right side and my foot was caving inward. So I was coming very close to walking on that middle bone of my ankle,
ow.
that inner bone of my ankle.
And how long did you have that issue before you went and had the surgery?
About 20 years.
Jeez, Lynn.
Maybe longer. Bad PA.
All right. So do as you say, not as you do?
Yeah,
Take care of health issues sooner?
So I am here with a whole new worldview. So now I have knee problems, actually. And,
Oh, no.
And it works its way up. So it allows locomotion, which is what keeps us in good shape, okay? And these structures change with age and functional demands. So mine was I was getting to the point where my foot was caving inward. My arch was caving inward so much that I was walking on that inner ankle bone.
Now, after the surgery, are you walking not on that inner ankle bone? Is it corrected, or is it still healing?
I still can't go up on tippy toes because I don't have the tendon. But my ankle is fused. I had a triple arthrodesis for the geeks that want to look it up. But I've got all this cool hardware, like screws going into my heel and all kinds of crazy stuff. But my
Yuck.
ankle is fused in such a way that I have limited mobility, but not zero mobility. So it's not completely fused, it's partially fused.
Okay.
But my x-ray is scary looking.
All that hardware in there.
I know. And speaking of x-rays, you can see a lot of little bones in the feet, and that's because of flexibility, right?
Yeah.
So feet have to go over terrain that they have to accommodate. They have to respond to, like sudden changes in direction and maybe starts and stops. And so they need to be flexible, but in that flexibility, they have to take a lot of weight, right?
Well, yeah, I kind of weigh a lot, so my feet are under a lot of strain.
Well, mine used to be, and I lost weight, and that didn't make them better, but probably in other circumstances would have. And especially arches are important because in part of that, being able to move and start and stop and go up on tippy toes and, go down with your heels lower than your toes, all that stuff has to do with things like arches and tendons and little bones. And there's not much in the foot, I should say, that isn't important to hold it together or keep it functioning.
Is that all of those little pieces and things like that, is that important to like balance, to reduce falls?
Oh, totally.
Okay.
So feet are made up of nerves, tendons, ligaments. Ligaments are what hold bone to bone, and tendons are what hold muscle to bone, and blood vessels. So there's not much in feet that isn't really important, and they're very superficial. They've got this big job they're supposed to do. They're called upon to be flexible, but also weight bearing, and they're also typically one with the earth, or at least with the shoes or the terrain that's being navigated, and it's super easy to hurt them.
Yeah.
Yeah, so we ask a lot of them, and then we go, ew, feet.
Right. They are. And then like there's Legos and they hurt us. And
I know. Believe me, I know. So foot care basics. How do we keep our feet in good working conditions so they don't hate us? Because walking, since the end of July, walking for me is like walking on Legos, and it's really,
oh, all the time.
ooh, ow, ooh, yeah.
Oh, I'm so sorry.
At least in some part of my foot, it moves around. The Lego's moving, and it
Ew.
is getting better. But it's done. It's not fun. You have a certain amount of post-traumatic, like you don't want to get up and walk across the room because you're not quite sure what you're going to feel.
Oh, I'm so sorry, Lynn.
What do you do to take care of your feet? So keep them clean. That should be straightforward, right? Especially
Yeah.
if you're diabetic. And you should inspect them daily, especially between your toes. One of the worst foot infections I've seen recently was because somebody had athlete's foot and they weren't aware of it, because they don't really check their feet every day.
Or were they diabetic and didn't feel their feet? Or like, how do you not know you have athlete's foot? Isn't it itchy and burns and stuff? Like, were there no symptoms?
Well, I think it was an older person. I don't think they were able to feel.
Okay.
And diabetes wasn't part of it, but she just never sat down and looked between her toes.
Oh my goodness.
And you really have to every day, especially between toes. And after a shower or bath, you have to take the time to dry them carefully, because, toes curl up as you age, and, they get squished in weird ways because of shoes. And you have to actually separate them and look down in there, because the areas between toes are really great places for fungus to live. It's kind of gross, but it's
Dark, moist.
It's moist, it's
Gotcha.
dark, there's a lot of debris to eat, and nobody ever comes by to give you any problems. So fungus are really happy there.
Ew.
Yeah, ew. It's important to trim toenails straight across to avoid ingrown nails. That's super important. And don't try and dig out your own nails if you have an ingrown nail. But that way lies madness. And I've seen so many really messed up toes. I saw somebody in acute care, a young woman who had infected ingrown toenails and didn't really know what to do about it, and her parents were unaware of it for about a year.
Oh my gosh.
And she had a big problem, and I am not entirely certain she got to keep her toes.
Oh my goodness.
Yeah, so it's horrible. A little thing like that causing a huge big problem.
Yeah.
So, that's where podiatrists are helpful. In Del Norte, the best podiatrist we have, at least the most accessible, is no longer working here. And the only person I can think of now is Dr. Fjorstad. And
I believe so.
He's here part-time.
And I don't think he takes partnership.
Oh, does he?
No, I think he just does Medicare.
Ah, okay.
I could be wrong on that one. So somebody, if you need a podiatrist and you're on partnership in Del Norte County or in our sister listening stations, then
Right.
verify that.
Yeah, there are some, there's a lot more availability of podiatry care in Humboldt County. There's quite a big practice there, Redwood Podiatry.
I keep hearing rumors that Dr. Turner is going to do podiatry one day a week here in Del Norte County for people who need it.
I would not be surprised.
Yeah, is there anything that guy won't do to help out people that live here?
I know. What an amazing soul. We're
He really is.
lucky to have him. Shout out to Dr. Turner. Thank you for your...
One of these days I'll get to meet him.
Yeah. Oh, I met him recently. He's a super... We've talked about his life on this show.
Yes, we have. I love that episode. I think it's one of our most listened to episodes as well. And I hear about him all the time from the patients in the community of the
He
homeless
is
people that he serves on a regular basis.
Amazing. So the next thing you should do is manage your calluses with a pumice stone. Gently and then moisturize the area. Do not cut them off with a razor. That way also is crazy, and you can get really, really big problems with that. And even though they're thickened and you don't really feel it, it doesn't mean you have the control to do that.
Yeah, that makes sense.
It's a huge mistake.
Before I forget to ask, when you were talking about in between your toes, and then you just said to, use a pumice stone and then moisturize, you're not supposed to put lotion between your toes, though, right?
Oh, no,
it's just the
that's
top
good.
and the bottom?
No, top and bottom. And I've been using wormwood, actually, and I think it's in a beeswax base.
Yeah, but that's still just the top and bottom. You don't put you don't put anything like that between your toes,
No, not
correct?
between my toes, but I do kind of the external surfaces and then put a sock on when it's like the last thing I do before I go to bed.
Gotcha.
Yeah, and my feet are in great shape right now except for the big old scars on them.
And the Legos that apparently float around inside of there.
And the evil little Legos. It's super important with all parts of your body to know what's normal and to get care if things change. And you would talk about breast health in that way, know what's normal and if something changes. But we don't really talk about feet that way. And I think that's important. If you're paying enough attention to really have a good idea of what's normal and then being aware of what changes, that can be super helpful so that you can get care in a timely manner.
That makes sense.
Yeah. Especially this time of year in these areas where rain happens so much. Now, trench foot is unfortunately a huge risk factor and problem in our homeless or unhoused population, not so much in the house, but we still plop through. I know before my surgery I wore canes all the time. I had wet socks all the time.
Oh, geez.
Yeah, not very smart, huh?
No.
So that I would say don't do that.
Don't do that.
That's a mistake. So...
yeah, trench foot is
next thing
surprising.
Get exercise, because regular exercise helps strengthen all those little muscles and increase flexibility, which improves your balance and decreases your risk of injury. So
is that especially important with our older population to reduce the risk of falls?
Oh, totally. And that if you look at your foot, there's a lot of what we call intrinsic muscles, which means tiny little muscles kind of interior to the main structures that kind of keep everything moving smoothly.
Okay.
And those are the ones that exercise really helps. And lack of exercise causes atrophy. So the feet can't respond very quickly to changes in terrain or direction, and then people fall.
Okay, so
take care of your intrinsic muscles.
You've said in other episodes of Health Matters that exercise was like gardening or going for a walk. It didn't have to be a specific...
house cleaning.
All of those things.
Yeah.
So just movement. So get up and move.
Get up and move.
Okay. So is that like an important thing to do as well? If you have like an office job and you're sitting in a chair for 8 hours every day, is to
totally.
get up and like stand on your feet? Or
Totally. And if you can get one of those desks where you can stand up, that could contribute to more movement. I know in our pod we have a nurse who has a standing desk, and he rocks back and forth and kind of. He's a fidgeter by nature, but he's moving around more than the rest of us who are just sitting there. So decreased risk of injury with exercise makes all the little muscles stronger. The obvious thing, get good fitting shoes, and that might be hard for some people who maybe don't have money for groceries.
Yeah.
To get good fitting shoes, especially for kids when their shoe size changes frequently. Can be really difficult. Shoes are expensive, and shoes have a little bit of a, I don't know, like a fashion sense that goes with them, although I find that kind of silly. But apparently...
Well, yeah, you have like 752 pairs of shoes because those ones don't go with that pair of pants, and you're going to wear this purse, so you need those boots.
Looked also at it like an investment. Like a classic car collection. You have a classic tennis shoe collection. I think that's a little weird. But
I agree. Yeah. But I don't like shopping, so there you go.
There you go. So get good fitting shoes that have an arch. And what I was told in some outdoor stores, the clerks are trained to give gait evaluations to help you figure out what shoes might address what problems, or at least don't make problems worse.
Okay.
I was kind of surprised by
this. Me too.
Well, the times I bought hiking boots in places like REI and stuff, I have gotten kind of insider information or a higher level of education about what shoes can do for you.
Wow.
So if you have access to that, don't be afraid to ask for it. And then with tennis shoes, get about 1/2 size bigger to accommodate foot swelling during exercise.
So like you wear a size 5 normally, then
Right.
get a 5.5?
Uh-huh.
Okay.
Yeah, because your feet apparently swell during exercise. And then you could always, if you're saying, look, hey, they're too big, well, wear 2 pairs of socks then. So consider orthotics that you might have. So when you're going out to buy a new pair of shoes, bring your orthotics. So orthotics are kind of like creating a personalized footbed of a shoe where your foot meets the actual shoe.
Okay.
And sometimes people's feet are, that's not the right footbed for them. And so you can go to a podiatrist, like me with my flat feet. I had orthotics for years and didn't really use them because I didn't understand how important they were. But it could have saved me, I think, a lot. Not ultimately, but it could have put off, the surgical choices I was faced with. So orthotics are personalized. They address specific problems somebody might have with the bottom of their foot and to get them walking better and to have a better fitting of a shoe in particular. So that's not hard to do if you go down there to Humboldt County and some of their bigger practices. UHS also has a podiatrist on staff, and he makes a lot of orthotics.
Okay.
Expect your shoe size to go up as you age.
That one was surprising to me.
That surprised me too, and especially if for a woman who's had children. There's something about the force of gravity that makes your feet kind of get squished down and spread out.
Yeah.
So, yeah. I don't even wear women's shoes anymore because my feet are too big. So anyway.
That happens to a lot of us.
So new shoes should feel like they fit. There shouldn't be well, I'll break them in. They should really feel like they fit the first time you try them on.
And that accounts for fashion too, right? Just because it's your tennis shoe collection and it's the new one and it's the...
Right.
So they should always feel like...
high heels. When was the last time you wore high heels?
Oh, I don't do that anymore. I am not a glutton for punishment. I do not do the high heels. But yes, I used to walk in a 4-inch spike on a regular basis. And yes, that was the whole thing. Was like, I have to break them in.
Terrible for people's feet. And bunions, a lot of bunions I see really horrible. So I don't know why women do that, but new shoes should feel like they fit. That kind of surprised me because my parents were always like, well, you have to break them in. That's because they just wanted to get out of the store, I think.
Yes. I think all of us have said that or been told that as growing up is you just have to break them in.
Right.
So you expect the blisters, you expect the sore feet for a couple of weeks.
Right. Well, we were wrong. Our parents were wrong.
Yeah.
If they feel like they need to be broken in, then they're not the right shoe for you. So who takes care of feet? We've actually talked about this a little bit. Doctors of podiatry or DPMs. And we have good access to these professionals, especially in Humboldt County. Dr. Alway is one of my favorites. Dr. Fjorstead is up here. He's in McKinleyville, but up here, I think, 2 days a week and in Brookings 1 day.
Yep.
And they are particularly helpful, I think, in keeping people's feet healthy. But every night before you go to bed, you should be brushing your teeth and then inspecting your feet. And and if you're not doing that as you get older, take the advice from me. You're going to regret it. So, and if your kids have weird little feet issues, like my problem didn't just start when I was aging. My problem started when I first started to walk at about 12 months, and there was nothing to do about it.
Wow.
And it just got worse and worse and worse and worse and worse. So, take care of your feet, and they'll make you happier.
All right, so I got lots of feet questions for you. Are you ready?
Yeah.
Okay, so you mentioned bunions. What causes the bunion? Is it just an ill-fitting shoe?
A bunion is where the great toe is pushed kind of laterally or to the side.
The great toe? You mean like your big toe?
Yeah, your big toe.
Okay.
And that joint is supposed to be like a straight line. the ball
Okay.
of your foot, then your great toe. And that's important because that's a really important balance thing. So people who unfortunately have to have their great toe amputated because of some infection in the bone or something, they really lose a lot of balance.
Okay.
But
So do you have to have bunions removed? Is there anything to do about
yeah, you
that?
can have bunions shaved down, I think. I don't know that they're really removed. It is painful surgery. As far as I know, it is not done up here. It's done in Humboldt County.
Is that a necessary thing, or can you just live with your bunion and be okay?
I think it depends on how much pain you're willing to go through, how problematic they are.
Okay.
But we definitely see bunions in women who wear high heels.
Yeah,
That's
I was
the
just
setup.
kind of was under the impression that having a bunion removed was a cosmetic thing, so that people didn't see it when you wore sandals for women specifically, and that
Yeah.
it's not a necessary thing to do.
No, I think it is. I think it is an important thing to do. I've seen them removed in my career when they were a functional problem, not a cosmetic problem.
Okay, so that if it's going to be a functional problem, then get it removed.
Right. It's the big toe is really important for lateral medial stability. So that means from side to side stability
Okay.
in walking.
So you don't want to mess with that. If you've got a bunion, go see the podiatrist and find out if yours needs to be fixed or not.
And get scolded about the high heels and listen to them.
All right. Now, what about what are they? Bone spurs? Those little bony growths that you get on the top of your foot from your shoes
know.
and things.
They're not on the top of the foot. Oftentimes they're on the heel, but they could be anywhere. We have bone spurs like in our back, for example.
Yeah.
Those are little islands of bone that the bone is responding to repeated trauma, and in an attempt to protect itself, it just hypertrophies or grows bigger and stronger. And sometimes that's like walking on that Lego. And
Okay.
people will have a significant amount of pain with it. However, super easy to fix.
Really?
Yeah, surgically or non-surgically. Surgically, they actually go in there and file them off or break them off and sand them down. But non-surgically, you could go to Walmart, to Dr. Scholl's little display, and get heel pads.
Okay.
And-
So as long as it's not causing you pain, it's okay to have a
Right.
bone spur.
As long as you're functionally okay, a lot of people have them and don't even know it.
Okay.
Plantar fasciitis is another thing that's probably worth commenting on.
Yeah. That was the next one.
So often seen in older people with maybe weight issues. And so one of the tissues in the foot is called the fascia, which is kind of something you would peel off a flank steak if you were cooking. It's really tough and white and fibrous.
It's a little silver skin in your foot.
Yeah,
Okay.
and it's kind of to hold the different tissues in their respective compartments. So it defines, a certain anatomical structure at the border where it turns into a different anatomical structure. And it's usually the first 5 steps are hellish pain for people. They almost all describe it like that.
Yeah, it's hard. It's horrid.
Yeah, it's horrid. And then, somebody will develop it and it will take months to calm down. And we say things as providers like, oh, roll your foot on a tennis ball or take anti-inflammatories. But really what you need to do is walk less. And you don't really want to walk less.
Yeah.
You have to keep moving in order to stay healthy. So my physical therapist gave me a hot tip on this where what you do is you sit down and cross your legs, have the affected foot be on your knee. Okay, so that's the one on your knee, not the one on the floor. And you take your great toe and you just kind of stretch it to full extension.
Okay.
So it would be dorsal extension. So
Full extension, like backwards or?
right,
Okay.
as it relates to the top of your foot. So you're extending towards the top of your foot. Now don't yank on it and don't make yourself cry in pain. Okay.
Just gently pull
But,
it back.
Yeah, this is like a gentle yoga stretch, and then you kind of
Is that stretching
stretch.
the tendon that's in that part of the foot?
right. You're stretching the fascia too.
Okay.
And he says that this is the exercise. He said, forget the tennis balls. They don't really help. But do this toe extension. And you hold the extension for about a minute, and then you relax for 5 seconds, and then hold the extension for about a minute. And you could do this while you're doing your inspection of your feet at the end of the day.
That makes a lot of sense.
Right. Super easy. And my hope is that patients start doing these things before they come and see us.
Yeah. So we covered that one. And I was going to ask that one first, but then I thought, since I had that issue, that I shouldn't cover it first. And it hurts really bad.
It does.
And then my other question is too, is like we have for our children, we have the well child check. We have, as women, we have our annuals for mammograms every 2 years if we need to. We do our pap smears. We do all of those other things. We have all of these. Is this something where we should have like a diabetic eye exam or any of those other things that they have us do, and they send us reminders in my chart to say, come in and get your feet checked, and have your provider look at your feet to actually say once a year at least?
It's amazing how many providers try and weasel out of it. It should.
But they're gross. Their feet.
I know. I think it should happen about every 4 months if you're diabetic, and maybe less often if you're in good control, and more often if you're in bad control. But as a diabetic, you should be looking at your foot every single day.
Every single day.
Yeah.
So it's my understanding that most diabetics do have a quarterly visit to have their feet checked.
Right.
But I'm just thinking, regardless of our age, regardless of our health condition or any of those other things, whether we're diabetic or not, should it be one of those things that's just a standard every year you do this?
I think as you age, maybe after a certain age, but those recommendations have documentation that it decreases mortality, morbidity.
Okay.
So mortality, death rates, and morbidity, like disability rates. And I don't know that a foot exam has that data, because feet are kind of like you. Nobody wants to talk about them.
Well, yeah, they're gross, and they smell funny, and they look weird. And
well, I don't know. I've been in acute care long enough that I'm kind of immune to all that. So I just grab people's feet. I don't care what their toenails look like. And I've seen some pretty disgusting feet. But and I don't usually do exams with gloves unless there's an infection component. I'm kind of over the gross.
You just wash them?
Stinky feet. I just wash my hands afterwards. But I actually think diabetics ought to sit there with their shoes and socks off as kind of a gentle hint.
So if you're diabetic and you're going to see your provider, just take your shoes and socks off and sit up on the table?
Yeah.
Gotcha. That's a good tip.
Maybe put a paper towel under your feet, because, the floors in the exam rooms are disgusting. But yeah, and
I was thinking because the floor was cold.
So what would the provider check for? They should check for any sores. They should look between the toes. They should check pulses. They should check nerve sensitivity, and they should do Achilles reflexes.
Okay.
And that's pretty much a foot exam.
There you go.
And at least the way I do it. And I think if you're diabetic, it should happen every 4 months. I think if you're an elder, let's say above 60 or 70, who's interested in mobility issues, that it should be part of any exam addressing mobility issues, as well as having the provider watch you walk up and down the hallway. Nobody does that.
They don't. I remember getting that done when I was a kid. You had to walk all the way down the pediatrician's thing and then turn around and walk back. And if you went too fast, they would tell you to slow down. And if you weren't going fast enough, they'd tell you to speed up.
Yeah, it doesn't.
And I haven't had to do that as an adult.
It's not part of the 7.5 minutes. So, I just be nice to your feet. Pay attention to that your socks are clean. Make sure your shoes are well fitting. Make sure you check them every night before you go to bed. And if you're in a position where you need diabetic foot care, then press the point, or it's going to get forgotten. So
nice.
Yeah.
Thanks, Lynn. I appreciate you bringing this to everybody's attention. That's kind of an important thing if we want to keep moving around.
All about the feet these days.
All about the feet.
Yeah.
So do you regret your surgery, or are you glad you had it?
No, I'm glad I had it, but it took a lot out of me.
Yeah.
Yeah.
Yeah, that's a long time to be non-weight bearing.
Yeah.
Well, thank you so very much. And thank you all for listening to this episode of Health Matters with PA Lynn Szabo. And we appreciate you being here. And we'll see you next week.
Thank you.